Oh, hi, welcome to today's webinar, Endometriosis, Women's Health in the Workplace, Building a Culture of Awareness and Support. I'm Claire Thomas, a Health and Wellbeing Consultant at Westfield Health, and today we're joined by our fantastic panellists. We have Julie Burns and Vicky Walker. Can you please introduce yourselves, please?
Hi, I'm Vicky. I'm the Group Director of People at Westfield Health.
Hi, good morning. I'm Julie Burns and I'm the Endometriosis Friendly Employer Scheme Manager with the charity Endometriosis UK.
Brilliant. Thank you both. I'm really looking forward to today. So it's great to have you with us. Before we hear more from our panelists, I just want to go through some housekeeping points. So the webinar is being recorded and you'll receive a recording shortly afterwards by email. If you've joined in listen only mode so nobody can see or hear you. You can ask our panel any questions using the questions box. We love hearing from you and we'll try to answer as many questions as we can. You'll see some resources that you can download in the materials section, so please make sure you take advantage of those as well. And during the webinar, we'll be taking polls to include audience members' experiences. The polls are completely anonymous, so please give your honest opinion, but we will share the overall results at the end. At the end of the survey, at the end of the webinar, a survey will appear on your screen. It would be great if you could give us your feedback so we can capture and shape future webinars and make it more personalised to yourselves. So what we'll cover today then, the impact of endometriosis on employees and the UK economy, fostering awareness and reducing the stigma around women's health and developing that supportive and empathetic culture, developing inclusive initiatives and policies that support employees with those chronic health conditions, and practical accommodations to improve employee retention and productivity, which is really important. So we've come together today as March is actually Endometriosis Awareness Month, and we thought we couldn't be a better time to highlight the widely misunderstood women's health challenges. This is a subject that's very close to my heart as well. So Julie, could you start us off with what endometriosis is and how it affects individuals and the economy, please?
Yeah, of course, Claire, thank you. So endometriosis is a debilitating condition. It's where cells similar to the ones in the lining of the womb or the uterus are found elsewhere in the body. So these cells can grow and change in response to hormones in the menstrual cycle and can cause inflammation, pelvic pain, adhesions and scar tissue. The main symptoms are usually around heavy, painful periods. It can affect your bowel and your bladder, but also causes chronic fatigue. Everyone's experience, however, is very individualised. Now, because of the long diagnosis waits, it does also affect an individual's mental health. Currently, endometriosis affects approximately 1 in 10 women and those assigned female at birth. So in the UK, that equates to around 1.5 million individuals, and 176 million worldwide. There's no known cause and there's no cure, unfortunately. The economic impact is huge and it's currently costing the UK economy an estimated £8.2 billion a year annually in loss of work and healthcare. So to try and address these challenges, initiatives like our Endometriosis Friendly Employer Scheme have been established. Since we launched that in 2019, we've had over 140 organisations join, and that's a mixture of small, medium, large, private, public sector, non-profit. So they are pledging to create a supportive work environment for their employees with endometriosis. Sufferers can typically have to go to the GP around 10 times on average before they are listened to or taken seriously. And left untreated, the condition and the pain can become more severe and affect more organs, potentially impact on fertility. So ultimately, it's costing the NHS much more than if it was diagnosed earlier. Diagnosis at the minute is taking an average of 8 years and 10 months in the UK. Now, we recently carried out a poll which revealed that 60% of women between the ages of 16 and 24 years and 56% of those aged between 25 and 34 years old would be concerned about discussing this condition with their employer if they needed to take time off work.
That's quite a sad number, isn't it? Do you know what I mean? Looking back at that, we want to create that culture where people want to open up and talk about this more. And I know that's definitely something that's really important. You shared some really insightful statistics there, Julie, building on your point about employees feeling hesitant to discuss the condition with their employer. Vicky, what are some other ways that endometriosis can impact employees in the workplace, and how can we support that?
Yeah, I think, as you said, Claire, Julie, there's some really frightening statistics there. And, as you've described, endometriosis is a chronic condition, and it's a condition that takes a long time to get diagnosed. And I think during that period, this is when employees are really struggling as to what to do at work, and often it may increase difficulty maintaining a working schedule. It may increase absenteeism where people aren't in the workplace, and obviously the fatigue could, reduce productivity as well. So there's lots of things to be mindful of that. I think also because it's not commonly talked about, the reasons for absence that some colleagues may share may not be the truth. They may hide it or mask it, and not feel like they're able to talk about it because it's not a condition that's widely talked about at the moment. So people may ring in with an absence or a headache when actually it's their endometriosis. And I knew I would struggle to say that. As difficult as the word is to say, it's as difficult as it is to
It's not the
diagnose as
easiest
well.
word.
No, no, it's absolutely not. I think maybe some colleagues may feel ashamed for not being able to work due to the symptoms. So yeah, I think there's lots of ways that it can impact the employees. As you say, whether it's with concentration, whether it's flare-ups, or maybe feeling pressured to continue working, which could ultimately lead to longer-term absence and burnout ultimately as well.
Yeah,
Yeah,
also,
definitely.
Vicky, if I could just add in there, we do hear from some organisations that don't even have a particular appropriate code for menstrual health absence. So again,
Mm.
your absence may be coded as stomach problems or digestive problems. So again, it's kind of masking the condition overall.
Yeah, absolutely.
100%. And the fact that there's no cure for it as well, you know, it's an ongoing condition that they're constantly going to have problems with. So it's all about making sure they can feel like they can talk about it and be honest about how they're feeling and, the way that they're feeling about it. So are we going to do a poll now then to hear from our audience? So we'd like to hear from our audience. We're going to launch a poll. We'd like to know about how openly employees at your organisation discuss women's health issues. Please be open and honest about this because it's really good to see the different, areas and different industries and how people are supporting their staff. With 1 in 10 people suffering with endometriosis, but not just that, chronic health conditions in general, it's really good to have that support in place for your actual staff. So there's lots of polls coming in here. That's great. Thank you all so much.
I think looking at those that are coming through, it's not surprising that it's still a bit of a taboo. I think that
Yeah,
those results so far aren't a surprise.
I think that tells us that it definitely needs to be talked about more and more openly within the workplace, 100%.
Mm.
So 45% of people say occasionally, but it's still a bit of a taboo. So that's a massive figure in that sort of genre. And what's your opinions on that, Vicky?
Yeah, I think, as you said, it's not talked about often enough, and I think it's, as you say, it's a taboo subject, just like mental health was many years ago. So yeah, I'm not surprised by those results actually. Yeah,
Yeah,
there's still this,
exactly.
discomfort of discussing menstrual health.
Yeah, that's a massive figure, 45%. Julie, a question on you. Endometriosis takes an average of 7 years to diagnose. If someone is not yet diagnosed, is this considered a disability then?
Yeah, well, sorry, just to add to that, but it is actually nearly 9 years in some parts of the UK. In fact, in Wales, it's nearly 10 years. It's 9 years and 10 months. But the average in the UK is 8 years and 10 months. So yeah, in the charity and between in our community, there's a very difference around the classing of a disability because a number of our sufferers do not wish to be classed disabled because of their condition. However, there are some cases where individuals cannot work. It may impact on whether or not they can walk, whether they have to walk aided. So obviously that then allows them to be able to use the benefits of those classed as disabled.
That's crazy, isn't it? I know my sister suffers terrible with endometriosis and it's affected her, really bad. And I know somebody else that suffers with it and they don't have the symptoms. So like you said, the symptoms are different for everybody. It's actually affected my sister having a baby and it's really affected her, to be honest with you. And that's the long-term effects of it as well. So there's no cure for it. There's definitely more support that's needed around this subject for people just so they feel like they can talk openly and honest about it. So with the so there's lots more information on our resources on our website. Please make sure you take advantage of that. There's some great information for workplaces to create that open culture, to feel like people can talk about this and go through everything together. So that leads me on to my next question then, which is really to both of you. Why do you think women's health and specifically endometriosis is still a stigmatized topic in many workplaces?
I think Julia obviously come in here, but I think there's still not just in workplaces, but a societal discomfort in discussing menstrual health and women's health. And I think many people, due to lack of knowledge, I think dismiss period pain as just normal, and it should just be something we get on with. But I think that can make employees feel invalidated, and that it's not normal. So I think it's a lack of understanding and a lack of awareness, really, for me. I think, which is still why it's stigmatised. Julie, I don't know anything to add there.
Yeah, no, absolutely. That's why our Action Month is always in March, and this year the topic is endometriosis explained. So there's lots of, again, as Claire said, there's lots of resources on our website for people to have a look, which we just want members of the public and the healthcare profession to understand that wee bit more about it. But there's also a big gender bias in healthcare, with some workplace policies meaning that women's health issues are still receiving less attention compared to other chronic conditions. There was a great report calling out medical misogyny from the government's Women's and Equalities Committee. It was just back in December last year. It's definitely worth a read if you get a chance to do that. But I think ultimately, for those who have endometriosis, a lot of your your friendship network, your family, they still think it's quite rare. But as we've said, it affects 1 in 10. So that's just as common as diabetes and asthma. It's very likely that everyone on this call will know someone who has either been diagnosed or has struggled to get a diagnosis with endometriosis. Personally, my own diagnosis journey took 28 years. So, it's more common than we think, unfortunately.
They blamed my sisters. They actually said that she might be suffering from mental health because of all of her symptoms. They didn't really look into it for a good 2-3 years. It's only that she kept going back. And I think that's the key as well. If you think you are getting misdiagnosed, make sure you keep on to those doctors, because sometimes they really not aware of the symptoms, and you just got to keep on to them, unfortunately, to get that treatment and the diagnosis that you actually need.
Yeah, we have a really good webinar that's educational on advocating for yourself, particularly for younger members of our community who maybe are not quite as bolshy as a menopausal 50-year-old woman.
That's brilliant. So 1 in 10 is so common, that to me, I was quite shocked by that figure. So how can workplaces create a more open and understanding dialogue then around those women's health issues to improve that?
Yeah, certainly for me, the first place is just normalising conversations around menstrual health and reproductive health in general. For all employees, male, female, non-binary, it's a discussion that needs to happen. Organisations should have open cultures and spaces where employees feel safe discussing their health related challenges, because as we've mentioned, it impacts on the economy, it impacts on you and your workplace in a huge way. So that might ultimately mean providing more education and training for managers, just so they feel understood on conditions like endometriosis. And I'm going to plug what we do at the charity. We're very happy to do that in any organisation. So please reach out if you feel it's something you'd like us to take forward for you.
I think that's a great point, Julie, because actually empowering managers to understand conditions can then help them to have the great conversations. Because often we say it starts with great conversations by line managers to open those sort of forums to be able to have those open conversations. But often if managers don't understand the condition, then it'll be really difficult for them to have those conversations. I think it's also thinking about being patient and curious with your colleagues to try and understand how they're feeling. If they're having a battle with the GPs as well, that will cause them some frustration. So how you can sort of have those curious conversations and the support that you can give them in the background. And that patience, I think, with it as well. And I think back to your earlier point, actually recognising menstrual health as a reason for absence and not coding it under something else, like, as you say, stomach problems. So even things as simple as that, to try and normalise the conversation around menstrual health. And really sort of try and to encourage your line managers to have those open and honest conversations. As difficult as they may feel uncomfortable, but I think if you can train them and educate them first, that will help take away that uncomfort around those conversations. But it's uncomfortable for the employee as well. So I think recognising that at the start of a conversation, saying this may be a difficult topic to talk about, but let's talk about it.
Let's
So I think,
create that awareness and let's make people aware of how it's like the menopause. Really, years ago menopause was never really talked about, but now there's so much awareness around menopause, and it's great to see that endometriosis is going down that way. I remember one guy saying in a webinar, I'm going to go home and apologize to my wife after this, because it was just like he was so shocked at what women actually went through. So if we talk about this a lot more, I do believe in years to come we're going to get, people are going to feel more open to talk about their women's health issues, and hopefully that will be the case with people like Julie and a charity in place as well, definitely going in the right way.
Yeah, and when you mention menopause there, Claire, it's maybe a good point just to note here that a lot of the treatments for the to alleviate the endometriosis symptoms involve chemical menopause. So it's not uncommon for someone in their 20s and 30s to have to make a decision to either live with a painful condition or to take a treatment that puts you into early menopause. Now that's just a huge other chapter that we could spend another hour on, quite frankly.
Could talk about that one for hours. 100%. Right, so I think we're about to launch another poll now to our audience. So the question is, does your organisation currently have policies in place to support employees with conditions like endometriosis? So yes, and they are well communicated. Yes, but they could be improved. No, but we are working on it. And no, I'm not sure where to start. So I like to see these polls just to see what the sort of views are across many different industries as well.
yeah.
And with the questions coming in, it's quite clear to us that something that needs to be talked about a lot more, really, and in that open culture. So far, no, and I'm not sure where to start seems to be the biggest one that's coming in, and 41% of people are saying that at the moment.
What I would say is people are starting by being on this webinar today. So investing an hour of your time listening to us talk about endometriosis is you're making a start. So you pat yourselves on the back for being here and giving an hour out of your day is what I would say.
Yeah, I
Absolutely.
totally agree with that, Vicky. It's good to be open and honest, and the fact that people are, then that gives the incentive to talk about this more and get this not so much of a taboo subject, which is great. So we had 42% saying no, I'm not sure where to start, but also 29% of people said no, but we're working on it. So it's great to see that people are looking to get those policy in place. We had 23% yes, but they could be improved. And then 7% of people said yes, and they are well communicated. So it's a very low number of people who actually got something in place at the moment there as well. So it's great to see so many people already have a policy in place to support their employees, and a lot of the audiences have said that there's definitely something that they need to actually work on and make that more talked about. So what are some key elements of an inclusive workplace policy for employees with chronic conditions like endo?
Yeah, so I mean, it's not rocket science really. A strong policy just needs to include flexible working options, and employers can expand their definitions of what this could look like. We know a number of our current employers have what we class as a high frontline working workforce, so NHS, education, railway, police, fire. So these are all people who don't necessarily have an office job and have the luxury of working from home more often than those who do. So it's just good to make sure that it's not a one size fits all, because as we've said, endometriosis is hugely individualized. You can have someone who may not have any symptoms for 4 or 5 months, or you could have someone who has symptoms for 3 weeks of the month. It's just that allowing that certain amount of flexibility to make sure that your staff with endometriosis continue to feel valued and that their contribution is important. I can give you one or two examples. One of our organisations is a large railway operator in the UK, so that's quite very male dominated workforce already, and this is a female train driver. Now she has a really good experience with her line manager, and she's been able to adjust her shift patterns when she predicts that she may be having a flare or has issues with chronic pain. So that for her is really, it's a really good, rewarding experience for her workplace. Another employer, a further education provider. So again, they have frontline workers who are teaching, but this staff member has been able to work with her manager on a sort of timetable that allows her to just teach, not for any more than 2 days in a row. So if she teaches one day, she might suffer from fatigue because she's been on her feet the majority of her time. So again, her working week is planned. So she'll maybe teach for 2 days and then she'll do her research and marking from home or from an office based environment. So again, it's really small things, but it doesn't have to be something massive like changing your whole complete absence policy.
I think to that point, Julie, sometimes we overthink these things around the support
Yeah.
that we can give people, and I think that it's around kind of having those clear conversations and thinking about what are the reasonable adjustments that both work for the employee and the employer. And we talk about having the conversations in the first place. And at Westfield, we use an inclusion passport. So it's an opportunity if people don't want to bring something up when they first start an organisation, they find it difficult because they haven't got that relationship with their manager. We've got an inclusion passport where they can write things down and what they like, how they like to be treated in the workplace in terms of what reasonable adjustments they would like or need, and it's an opportunity for them to, in a safe way, talk about the endometriosis or any other chronic condition they've got. I think also, HR would also suggest involving occupational health as well if you need that sort of
Yeah.
external support and that professional advice around adjustments and if there's any accommodations that would need to be made as well. So I think there's
Sometimes
things
that
out
can be, yeah, sorry for interrupting, Vicky. Sometimes
there.
the involvement of occupational health can be seen as a negative, but it's absolutely not.
Yeah.
It's a really good way for those with endometriosis to be able to manage during the work time.
Yeah, and if staff feel like they can talk open and honest about that, then that's a conversation they can lead to, and then you can refer them on to Orc Health. But if people don't feel like they can talk about it, it's not going to get to that stage. So it's all about creating that open culture where, like in Westfield, do it very well, where you feel like you can talk about any problems you have and you don't feel like embarrassed to say things, because it's creating that culture where actually it's okay to talk about it. So, Vicky, what role do senior leaders and managers play in fostering inclusive culture for employees with long-term health conditions then?
Yeah, I think, as you said, and it feels like we're repeating ourselves, but really speaking openly about workplace wellbeing and normalising mental health. Yeah, talking about it. think policy changes that make a real difference. And I think to help shape policies, maybe involve people that have had a lived experience. Get
Yeah, that's
people that
very powerful.
have had endometriosis to tell you what things would have helped them. I think that's really, important as well, because people that haven't had it might be just second guessing. So thinking about how can you involve colleagues that have had that condition as well. In terms of obviously Julie talking around training managers, so thinking about how you can educate your managers to be able to have the conversations and to be able to understand the condition as well. And then maybe measure how successful you are in terms of how people are then openly talking about things and making it a normal conversation.
Yeah, because if
Yeah,
managers
sometimes,
don't know, oh, sorry, Julie.
sorry, Claire. No, I was just
No,
going to say sometimes it just takes that little bit of courage, and it may be that you're, as an employee, you're not particularly keen to have that initial discussion, but something that we suggest as well, just send your line manager a link to our website and get that
that's a
conversation. If
really
you're
good
not,
idea.
you don't really know how to start that conversation, then just say, look, I think I have this condition, or I've just been diagnosed recently with this condition. Here's a website that shows you all about how it will impact in my work. And then any decent manager worth their salt is going to go and research that themselves just to make sure that they know exactly what they're dealing with and how they can support.
Exactly. And if managers are more aware of this topic, then they won't feel like it's an issue to talk about it as well. So training the managers up on topics like this is always key as well in that sort of environment.
I think
Right.
also, Claire, think about your senior managers. Can they lead by example? So,
Yeah.
is there a manager in your organisation that's willing to talk about their own experiences as well? So, I think that always helps um, that point of view to be able to see it's okay again to normalise things.
100%. And again, it just comes back to the same thing that we're always talking about, is to talk about it more, create that open environment to make sure people can talk about that, and then go on to everything else. So Julie, what's some of the small but meaningful workplace adjustments that can make a big difference for employees with endometriosis then?
Yeah, I mean they seem really small, but they can mean a lot. So one thing, and as you're probably aware, I'm from Scotland, so it's quite slightly different in Scotland in that there's a lot of organisations and places that offer free sanitary products in the women's toilets. So again, we work with a number of companies that can provide sustainable products that you can find on our web pages. So something like that goes a long way. Obviously, you may symptoms can arise at any time, not just as part of your cycle. So you may be caught out and have no products on you. But again, other simple things, just allow more frequent breaks for someone to be able to manage their pain or their fatigue. Another really good thing that we've heard about is sort of ergonomic seating or a sit-stand desk. So quite often someone can have the need to wear a large heat pad and their comfy joggies and leggings on the bottom half of their working Zoom Teams picture. So yeah, just a little something like that, a sit-stand desk at home or in the office, quiet and little sort of rest spaces for employees to use if they are able to get away from their desk, and those who are able to obviously work from home during flare-ups. So not a huge, not we're not changing the world, but these small things do really make a difference.
I think working from home is a big one at the moment. I think since COVID, that's become more the norm now, isn't it? Working from home. So that's an easy option for employers to give to their staff if they've got the resources to do that. If you're feeling unwell today, take a day in the house and work from home if that feels better for you. So it's giving those employees those options and making sure the flexible working is in place so they can actually do that as well. So, are there any technological solutions or workplace tools that can help employees manage their condition while maintaining productivity? Is my next question.
Yeah, so there's lots of different digital flow trackers or symptom trackers that can help employees to monitor their health and plan their workload accordingly. On our website, we have an endometriosis symptom tracker, and I have to say a huge thanks to Westfield Health here who've provided the funding for us to launch this. The tracker is great. You put in your symptoms and it then generates a letter on our headed paper for individuals to take to their GP. Now, in the first 4 months since that was launched, it was completed by over 6,000 individuals. And that page on our website is consistently one of our most viewed. It's been visited by over 15,500. So again, a huge thank you to Westfield Health. That makes a big difference there. The other solution is really just obviously to encourage these open discussions to create a better understanding and awareness.
I think also, Julie, you mentioned earlier that women have to visit the GP around 10 times before they're even listened to. Now, if the GP is in everyone's local area or anything like mine, it can take you however many days to get through to get an appointment in the first place, and you're on hold and then all the appointments are gone. So that frustrating piece there around even just getting into the GP, then trying to get in for 10 times before you actually listening to. So I think,
Yeah.
is there anything that employees have got to help fast access to treatments and to GPs could help in terms of do you have either a cash plan or a PHI provider that gives you access to a virtual GP, and maybe that can provide you quicker access to the medical advice, maybe depending on the T's and C's of that sort of support service. But that could be one. I think just helping break down those barriers of access to GP services, as we all know, are so under pressure at the moment as well.
And it's getting worse as well, so that's probably going to get worse as times go on, really. So the fact you've got the symptom tracker there and you can take that to your GP, I think that's going to shorten, hopefully, the amount of times that people have to go to the GP then as well. So what advice would you give to managers who want to provide better support but don't know where to start then?
Yeah, again, from me, it's just about educating yourself. Read up on endometriosis and its workplace impact. As I said before, we've got a huge amount of free resources on our website for anyone to access. And just that little tip about overcoming any stigma, email your staff member to say, look, you've had a look at the website and if there's anything at all that you can do to help, this will make them feel hugely valued that you've taken the time to learn more. Promote awareness. Go away from this webinar this morning, go back to your workplaces and mention this at your next team meetings. Again, just open up that conversation, really.
Yeah,
Let's
I
make it a
think
more talked about subject, isn't it?
Yeah,
Yeah,
yeah.
I think one of the biggest things that managers can do is lead with empathy. So think about, the way that you ask the questions, even if you don't understand, if you're learning and you're going to Julie's website and you're looking about things, showing that you're empathetic about the situation and that you've got a supportive approach, whether you've got all the answers or all the education or not. I think start by, having a supportive approach will make a huge significant difference in terms of how people feel, and then create those open conversations more. And for me, I think we've talked about it earlier, but where you can, being flexible, understanding that symptoms may fluctuate. So like a rigid policy won't always work. And Julie said earlier, one size doesn't fit all. So treat people as individuals, really. And I think, the main thing for me is that supportive approach and that empathetic ear is what I would say.
100%. And I think, it sounds like we're mentioning the same thing over and over again, but it's right. The more you talk about it, the more it's going to be not so much of a taboo subject, and the more staff feel like they can actually talk openly and honest without feeling embarrassed. It should never be somebody feels embarrassed to talk about it. You should always feel like that you can have that open and honest conversations with your manager or whoever that may be within your business. But yeah, I think this is a great place to actually start. So I think it's now anything else we want to talk about today, guys, before I go on to any questions.
I think there's a couple of questions in the chat, but Julie, I think they're heading your way. I'm afraid I don't think I can. very technical, and I'm going to struggle definitely to pronounce
Yeah,
endometriosis. Yeah.
yeah, yeah.
Adenome.
Adenomyosis is
I'm glad you
Right.
said
also,
that.
yeah, it's also hugely common with those who have endometriosis. So personally, I had both. So when you have endometriosis, it grows outside of the womb and the uterus, but adenomyosis is very similar cells, but it's inside of the womb. Again, there are hugely very different treatments for it, but there is a cure for adenomyosis, but that is removal of your womb, which is obviously a hysterectomy, which obviously impacts on fertility. So yeah, it's we do again have some good webinars on our website on adenomyosis, but yeah, it's very common and unfortunately in endometriosis sufferers as well. I think it's over 70% have both.
I
Yeah,
didn't
but
even
don't
realize
quote
that
me on
was a thing myself, to be honest with you.
that.
Yeah. Thanks very much for explaining that, Julie, and thanks both of you for that really in-depth conversation there on how we can create more awareness and get this subject not so taboo, so people feel like that they can talk about it a lot more. So I think it's now time to answer some audience questions, which I'm looking forward to, actually. I can see we've had lots of questions, so we'll do our best to answer as many as we can, and then we can go through all of the questions. So let me just have a look what questions are here. So one of the questions, I think this is, we are a retailer, so I'm thinking more around customer facing colleagues. Do you have any suggestions for workplace adaptations for those who don't have the ability to have a day at home or sit and stand desk?
Yeah, again, is there the opportunity for them to have more breaks during days when they're having flare-ups? So do you have a staff space? Could you create a little staff room? I'm assuming there's probably somewhere where the staff take their breaks. Is there an opportunity for them to have more breaks? Again, it's really difficult when you have frontline workers, and we only just have one retail customer on our scheme just now. So they've just joined last year. So we're really looking forward to working with them and hopefully having some top tips for other retailers. But it's very difficult when you do have frontline workers.
Yeah, I think not everybody can have that option from working from home or, having a sit stand desk. And there is a lot of industries around like that as well. But like you said, Julie, creating that safe space that employees can go to and also just making sure they can talk openly about the way they're feeling will create a massive difference on how that actually works.
Yeah, that could actually mean that they will 100% make more of an effort to come into work because they feel supported rather than have to take a full day absence.
Exactly.
Julie, could you remind us on the name of the digital flow tracker? Because the statistics on that was great. How do people find that if they are looking for that digital flow?
Yes.
Yeah, I didn't actually name any of the flow trackers, but there was the symptom tracker is the one that we have on our website. But I've not had any feedback at all about digital flow trackers. But maybe you guys in your industry would know more about that.
Yeah, no, we've not had any. I was just wondering if there was any you would recommend or any that you've come across really.
Sorry about that. Other than ours, which is more around symptoms, really.
Yeah, definitely worth doing that symptom tracker though, especially if you're getting problems with your doctors misdiagnosing, in your head sometimes what that problem is. So if you can get on that symptoms tracker and get that printed off on a letterhead to take to your GP, I think to me that's amazing. That's going to help people get diagnosed a lot quicker than what they were previously.
Yeah.
How do people become a member of your charity then, Julie? How do they sign up?
Yeah, so it's really easy to sign up. They just go to the web page, endometriosis-uk.org, And there is a page on the endometriosis friendly employer scheme there, and that tells you that you can just literally sign up. There's a button to sign up instantly, or if anyone wants to connect with me on LinkedIn, maybe we could put my email address at the end of the chat. I'm quite comfortable with that. If people want to connect with me directly, that's no problem at all.
That's brilliant. And can any organisations become a member as well? There's no limits or anything like that?
Absolutely. We've got from, household names like British Airways, a number of the rail operators. We just last week signed up LNER. We've got TransPennine. We've got a number of NHS organisations, education, universities, smaller businesses. Yeah, it's not an accreditation, it's a pledge. So we're not here to police organisations' policies. We're just here to provide support and additional resources. So again, it's more of a pledge, and we do find that a number of customers, clients, organisations who join up are already doing so much anyway.
Yeah.
And it's just a very small admin fee because we are a charity.
100%. Another question that's come in is, it's one that I actually am quite curious about myself. Does exercise ease the symptoms of endometriosis at all?
So we do have a number of really good stories around that, and it's really hard because it is such a negative diagnosis, and it has such a negative impact on all parts of your life, working life, home life, relationships, sexual relationships, fertility, mental health. But exercise in itself, because of where we are now in this day and age, everyone is about getting their steps in, drinking their water, making sure they're eating enough protein. So definitely exercise, it can really help. But again, if you wake up and you've had a really particularly bad night and you've not slept, the last thing you want to do is jump on a spin bike, you know? So it's about that individual um, kind of aspect. So a lot of other pelvic physio, uh, you know, homo, oh, I can't think of the right word, homeopathic remedies. Again,
Yeah.
um, a one size fits all. So aromatherapy, acupuncture, exercise, diet is a big thing as well. Different diets can really help ease the symptoms. But in terms of exercise, absolutely, if you can get yourself up for a walk, or something a little bit more of exertion, then you get that whole dopamine going around, and it can really help in some cases.
Like you said, I think everybody's symptoms are different. So I think it depends on how that person is feeling on that day, I suppose. Sometimes you can, like you said, you're not sleeping, but if you can get out, then it's always going to help you, I suppose. Would you recommend a general policy for people dealing with chronic diseases rather than a specific one for menstrual problems, or is there something different people need? That's another question that's come in.
Vicky, you go first on this one.
Yeah, I mean, I think if you had a policy for every chronic condition, you would have a book full. So I think it's just understanding that overarching policy could apply in different chronic conditions, but understanding that each chronic condition will need different support. Again, one size doesn't fit all, but I think, yeah, if you were to have a policy for every condition, there would be too many to mention. So I think for me, I would advise a more, the more general policies that then can be taken and specifically adapted for each condition, depending on the support that individual needs. I don't know if you'd feel the same, Julie.
Yeah, absolutely. In terms of chronic disease, however, obviously I'm going to say that it would be much better if you had something that was menstrual health focused. The new Employment Rights Bill, we are campaigning really hard for that because they are looking to ensure that employers of a certain size have a menopause policy, but we are trying to campaign that it should be menopause and menstrual health. I'm not sure how far we'll get with that, but we are trying really hard. So if there's anyone on the call that can help us with that, then please feel free to. We've got lots of different ways that you can ask your MPs across the UK to join in with that.
I think if we can get that in place with the menopause, is definitely something that would work well for the future, So it is women's health, really. and it comes under that menstrual path, I suppose. So yeah, good luck with that, Julie. So what would another question that's come in? Would you mention endo to a new employer, or would you wait a while, as would worry mention it early on if it could affect job prospects?
Yeah, for me, I would absolutely mention it straight away. Maybe not in your interview as such, but certainly
Yeah,
when you're there, if you start feeling like you're having symptoms, it's going to impact on your attendance, then absolutely it's about opening that conversation straight away. And if you're lucky enough, you might work for an organisation who already is endometriosis friendly. And if not, you can encourage them to join.
Yeah, I think I would echo Julie's points there. As you say, maybe not in the interview, but I think certainly in your first week, absolutely talk about it, and absolutely talk to them about how they can help you and how you manage your symptoms and what you need from your employer. Because if they don't know, they can't help and support. So I think again, I would encourage that conversation happens as soon as you can.
definitely. Another question, they're flying in at the moment, ladies. I like this. So, as a line manager, how can I start conversations about women's health with my team? That's a really good one, actually.
Yeah, that is a really good one. So you've got lots of different months that you can jump on the bandwagon of. So March is
Yeah,
endometriosis awareness, October is menopause awareness. I think May might be women's health in general. But certainly
it
just
is, yeah.
just put that on your agenda and say, look, that this is March, we're going to talk about endometriosis, or this is October, we're going to talk about menopause. Yeah, just make it something that maybe comes up every quarter. And the
And
same
Yeah,
the same for men's health issues as well, obviously.
we do lots of
I,
free resources on our website around women's and health and men's health, and they're all completely free. But here at Westfield Health, we also do lots of chargeable webinars on specific topics. So if you are focusing on specific days like Women's Health, Menopause Day, and things like that, there's always something that we can support you at. We've got lots of free things, but we've got lots of chargeable things as well.
I think back
Sorry,
to that
Vicky,
as
if I
well.
interrupted you then.
That's all right. Obviously, people have been on the webinar today. I think go back and share that with your team. Say, I've been on an endometriosis webinar today, and hopefully you'll say it was really interesting and I've learned something. And then share what you've
Yeah.
learned with your team. I think that's a starting point of having a conversation.
100%. Again, it goes back to just talking about it, isn't it? That's all we need to do is just talk about it more. How can I get leadership team on board with highlighting women and men's health?
Yeah,
I would start with the impact it has on the amount of people that end up being off
economy.
work through absence. Always start with what it means from a cost point of view, because I think then there's
Yeah,
your hook to be able to have more conversation. So highlight how many days are then lost due to ill health in the workplace. I don't know, Julie, would you say the same, or would you come at it at a different angle?
No, absolutely. I think that figure of 8.2 billion in the
I
economy
was just
is
going to
is,
say that.
is pretty challenging for organisations. And one organisation we signed up just at the tail end of last year, and I presented online to their senior team. Now there was 10 in the senior team, 5 of them were women, 2 of them had endometriosis history. So again, they were really keen to share that across their organisation, a huge organisation with 7,000 staff. So again, having that, you just might find that your leadership team, if there are any women or those assigned female at birth, they may have either their own journey or know someone in their family or friendship group. So yeah, it's just again opening up that conversation.
Yeah, and it does start with leaderships. You do need to clue them up on it as well, maybe. And sometimes as an employee is to talk to them and say, actually, we need to talk about this more, so opening up that conversation in general. Do we have any more questions? Let's have a look. So final question then. Vicky, you mentioned a passport earlier. Can you suggest where to start with this and what it could include, please?
Yeah, so our passport, it sounds super fancy, but it's something really simple that's given to somebody on an induction, so on their first day. and it includes things like how you like to be communicated with, anything about any caring responsibilities you may have out of work. It also talks about any health conditions we may need to be aware of, and I think that it's got some really open questions that people can type in and either just send to their manager, or they could have a conversation if they're feeling really confident to have that, but they could just send it, so it gives them, the manager, some insight into how that person likes to be managed and how they can make them feel included at work. So that's why it's called an inclusion passport. If there's things that you feel your manager needs to know about you to get the best version of you at work, because that's what everybody wants ultimately. Everyone's come to work and be the best version of themselves. So yeah, that's where we've started with it, and it's rolled out in induction, but we from time to time then just pop a reminder out there to our colleagues that we've still got this. So you don't have to do it just because you're a new employee. You can do it at any point during your employee life cycle.
I suppose if you're doing it within the induction as well, it makes that employee feel, it really does, that they feel like they can talk about it then. You know what I mean? So if you're opening that conversation up straight away before that employee started with you within their induction process, I suppose that gives them the chance to feel open and honest and feel like they can talk about those problems then as well.
Yeah, we actually did that and before I joined the charity, I worked for a university, and as you could probably guess, I was the champion there as well. And we did just a little 2-minute video on endometriosis, on what being a friendly employer meant, and that became part of the induction process for all new staff. So it's just something very, very similar, very if small but effective. Just you can include the link to the website in your induction material.
That would be great. And you know what? There's so many people sharing their personal stories within the chat box as well. And that tells me that 1 in 10 is definitely, a true figure there. Lots. So thank you everybody for sharing your personal stories. It's really appreciated. And it's very personal to me as well and my family. So I've really enjoyed today. And I think we are coming up to out of time at the moment. We've run out of questions. Somebody's asking, sorry, one more question, guys. Can they connect with you on LinkedIn if people want to?
Yes, please,
Absolutely.
please do.
Yeah.
Yeah, and feel free to connect with me as well if anybody wants to. So unfortunately, we are out of time. Thank you to everybody for taking the time to join this fabulous endometriosis talk that we've had today. Thank you, Julie. Thank you, Vicky, for sharing your expertise and just creating that open conversation to how we can get through it. We didn't get a chance to answer everybody's questions, but thank you, everybody, for being open and honest within the chat box. We'll do some follow-up blogs on our website to try and cover some of the common topics and the other questions that come out as well. Don't forget to download those free handouts and visit the Endo website that Julie was on about. We'd appreciate your feedback via our survey, and that will appear at the end. That will also guide us into future webinars and how we can improve them as well. You'll also receive an email shortly with a recording of the webinar. So if you want to show it to anybody else, please feel free to do that. And if you'd like to speak to one of our health and wellbeing consultants about supporting wellbeing in your organisation, please speak with one of your account managers if you have one, or you can contact us by email, and that's on businessinquiries@westfieldhealth.com. We are hosting another webinar on the 12th of May, so we really hope that you can join us. Vicky will be joining us on that one too. So we've put a link in the chat. It's called Belonging at Work and How to Create an Inclusive, Connected Workplace that Empower Your People to Thrive. Thank you, Vicky. Thank you, Julie. I've really enjoyed today. It's been a great little chat. And thank you, everybody, for joining. Take care. Bye-bye now.
Take care.
Thank you. Bye-bye.
Bye.